Hi, I'm Austin, and I'm making a series of videos about my hair transplant journey. What you're seeing right now is 2 months after my hair transplant. So all the transplanted hair has fallen out, and what you're seeing is my natural hairline. But I'm going to take you back to where it all began, and that's with my virtual consult with Dr. Huber 5 months ago. Let's take a look.
Hi, Austin. Nice to meet you.
Hey, Dr. Huber, great to meet you too, virtually, I guess.
Yeah, I know we've had a brief conversation on the phone already, but it's kind of nice to see you face to face, so to speak.
Yeah, well, I'm really excited to find out a little bit more about getting a hair transplant for myself.
Good. So let's get started. So the best place to start is tell me how old you are, but also tell me just like a little brief history of your hair loss, for example, when you started losing your hair, how fast you lost it, that kind of thing, and then we'll go from there.
Yeah, so I'm 48. I've been losing my hair since my early 20s.
Okay.
I've been able to keep most of it. So I've been taking Propecia or finasteride and Rogaine and other hair products for some time now. So I've been able to kind of keep it. But I think when I started taking it, I already lost quite a lot. And then at some point, I thought that I would just kind of go bald. I actually have a twin brother who has the same hair loss as me, but he didn't take anything.
Yeah.
So he actually started shaving his head in his late 20s. So I figured that that's what I would do. But then when I shaved my head, I kind of was a little shocked, and it kind of made me rethink getting a hair transplant. So then I started kind of going back on the medication. But because I was off the medication, I'd kind of lost a little bit more.
Yeah.
And so, yeah, it just kind of, I feel ready now that to go forward with a hair transplant.
So it sounds like you have a strong family history. You've got a twin brother who's got hair loss. Anybody else in your family has hair loss? Yeah.
My uncles, and then my dad has some hair loss, but it really didn't start affecting him until he was like 60.
Okay. And already I can see that you have a pretty clear genetic pattern to explain your hair loss. And that makes sense given what you're telling me about your family. What are you currently on right now? You may mention that you have in the past used finasteride and minoxidil, which is also called Rogaine. What are you on right now?
Yes, that's what I'm taking right now. I'm
Okay.
taking both of those.
And how long have you been on those consistently? You said there was a break, but since that break, how long have you been on those treatments consistently?
2 years. I took a break about 3 years ago.
And are they working right now to help at least slow or stop that hair loss?
Yeah, it's working. I'm not sure if it's just slowing it down or if it's stopped it completely. I
Okay.
believe it's working because when I look at my brother, he's completely bald. So I know it's doing
Okay.
something.
So I know you sent me some pictures and I've had a chance to review those, but I would like to see on the video as well, kind of the areas of concern that you have. And I know you were having some concern with the hairline and the frontal scalp and maybe something in the crown as well. So as best you can, show me in the camera those areas of concern for me.
Okay, so let's see so that's my hairline.
Okay, so you've got some recession of the hairline and some recessions into the mid-scalp and some loss of density there, and a little bit of a smaller area in the crown that's kind of going as well. Is that about how, when you look at yourself and you see yourself, is that about what you see as well?
Yeah, that's what I see right now. And I know this
Okay.
camera's not picking it up, but I am going gray, and that's also having
Yeah.
an effect on the volume of hair that I seem to have. So um, that's another reason why I felt it was a good time to get a hair transplant.
Okay. So if you're ready, let's just talk about some options as we move forward, and you'll have some questions along the way. So feel free to interrupt with questions, and we'll kind of get everything covered so that we can understand what works for you. The first thing I like that you're doing is that you're on finasteride and Rogaine, because at least the problem isn't getting worse. You know, we have some work to do to restore what you've lost, but at least we're not going to be taking steps backwards as we take steps forward. And you've been on those for a couple of years, so any regrowth that you might have gained from those, you've already gained. So it's not going to get any better by just relying on those options. So I think surgery really is your only viable next step. There are some additional options that we have to slow your hair loss, but what you're doing is working relatively well. So I don't think we need to add, things like laser or PRP in your case. I think really surgery is the option to restore your hair. Does that make sense from that point of view for you?
Yeah, that sounds great.
Okay. Have you looked into at all surgical options, like the difference between FUT or strip surgery and FUE, which is follicular unit excision? Have you looked into that a little bit?
I've looked into them a bit, but what would you recommend?
Okay, so the sort of next step in making that decision is I'd like to take a look at the back of your head, which is your donor area. That's the area that we're going to harvest those follicles from. So if you could just even turn around for me so I can see the very back of your head and the sides as well, then I'll get to assess your donor area. Yeah, great. And if you could show me the sides as well, that's perfect. Great. All right, that's perfect. You can swing around back front facing. Perfect. So you have a fairly good donor area. So you actually have a couple of options, and I'll just sort of briefly go over them so you have a broad overview of what they are. And in FUT or strip surgery, what we're doing is we're extracting a strip of your scalp from the back, meaning from ear all the way around the back to the other side. And then we're taking that strip of scalp, which of course contains follicles. We're dissecting that into individual follicles and then using those to go into your recipient area. The disadvantage of that approach is that it will leave you with a linear scar at the back of your head. So you'd have to keep your hair at least about 1 centimeter to 1.5 centimeters long to cover it up. But the advantage is that you don't need to shave the donor area in order to do that extraction. On the other hand, we have the FUE option, which is follicular unit excision. And in that method, what we need to typically do is shave the donor area, meaning the sides and back of the head, and then we extract the follicles one at a time using a very small punch that's less than 1 millimeter wide. So there's no linear scar. And for the vast majority of people, no visible scars at all, meaning you could do what you want. You could cut your hair very short, have a fade, shave the back of your head. And in your case, based on what I've seen, I think realistically what we're looking at is about 2,000 grafts to do your hair restoration. And I think in your case, probably the better option is to go with an FUE excision. I don't think that we need to leave a linear scar in the back of your head and extract 3,000 or more grafts in your case, especially given your age. You want some options in terms of what you might do with the hair in your donor area as you get older, as hairstyles change, etc. So I think in your case, 2,000 grafts by the FUE method is going to be the ideal surgical solution in your case.
Okay, that sounds great. Is there anything else that I should know about, like getting a hair transplant?
Yeah, so basically what we're going to do is we're going to take those follicles from the donor area at the back and sides of your head, and we're going to use those to move them to the recipient area, which is where you're having your thinning. So what we're going to do is we're going to use that to reestablish an age-appropriate hairline for you in the right place for you, taking into account your anatomy, how far apart your eyes are, where your hair is along the side of your head, all kinds of things that we take into account to design a hairline. And then we're going to fill in density behind that through the frontal scalp. And I think in your case, that's going to take about 3/4 of the grafts, or maybe about 1,500 grafts or so. And then the remainder, the 500 grafts, we'll use to fill in some of that density in the crown there. We always have a little bit of flexibility in a case like yours, where if on the day of surgery, I'm looking at things and I really feel I need 2,100 or 2,200 grafts, and I can always, by the FUE method, make those small adjustments on the day of your surgery so that we're only extracting the number of grafts that we actually need to do the job that we need to do.
Okay. I guess what just having a recessed hairline for so long, I've kind of had hairstyles that I've kind of tried where I've tried to hide my hairline. What kind of expectations should I have for what a new hairline could look like, new hairstyles, things like that?
So obviously the wrong thing to do is to give you a hairline that you had when you were 18 years old, because you're not 18 years old anymore. And in 10 years, you're definitely not going to be 18. And in 20 years, you're for sure not going to be 18 years old. So we're going to take, on the day of your surgery, we're going to spend quite a bit of time designing that hairline. Like I said, taking into account a whole range of options, from your specific and unique anatomy, to, common hairline design techniques that look natural, that will make sure that even if you did have more hair loss down the road, it would still look natural so that we won't have to catch up with more and more hair transplants down the road. And essentially, you'll be able to do whatever you want with that hairline. It's your own hair in a hairline that's a natural place with more density than you have now. So for all intents and purposes, you can do whatever you want with that hair and style it however you want. So Austin, another question that people often ask me is whether they need to keep taking their medication. Like, you're on finasteride and Rogaine, and a lot of people wonder whether they'll still have to do those things after their hair transplant. And what I tell them is the transplanted hair that we transplant is harvested from a permanent zone at the back of your head. So that hair will never fall out for all intents and purposes. But the remaining hair that you still have on your head today, our goal is still to keep that. So yes, we'll still have to continue those options that you're currently taking. That medication that you take, I would recommend that you still take it so that you don't lose the non-transplanted hair that you still have on top of your head.
So, Dr. Huber, another question I guess I just have is like, what does the procedure look like on the day, and then what is the recovery process like?
Good question. So for overall, a 2,000 graft procedure is going to take about 8 hours, give or take. So what happens is you'll arrive at our clinic, on the morning of your surgery. You'll be greeted by our clinical coordinator. She'll escort you to your room. We do some normal routine medical checks, your blood pressure, heart rate, that kind of thing, just to make sure you're in a healthy state for surgery. I'll come in, we'll take some pictures, we'll design that hairline together. I'll start and I'll tell you what I think is the right hairline for you. You'll have a chance to, give your opinion, and we'll work on that together to establish that hairline. And then essentially we'll get started. So we'll position you on the operating table. I'll freeze the areas of your donor area that we're going to be working on. And essentially that's like a dentist appointment is the right way to think about that. So small little tiny needles that will freeze that area. Usually that lasts about 30 seconds or less. And after that, you won't feel anything. We'll spend the first few hours extracting all 2,000 of those grafts. Each of those grafts is going to go to one of our inspectors who looks at it under a stereo microscope to make sure it's a healthy graft, it's intact, there are no missing pieces, etc. And then we'll store those in some chilled saline to preserve them. We'll extract all 2,000 grafts that way. Then we'll turn our attention to the recipient area. We'll freeze that recipient area. That's where the new grafts are going to go. Again, that takes about 30 seconds of these little tiny mosquito bite needles. Then what I'll do is I'll make all the sites, meaning little incisions where those new follicles are going to go, paying special attention to the direction, the angle, the location, etc. And then the last part of your surgery, which is the longest part of your surgery, is placing those follicles that we've extracted into those sites, into those little tiny incisions. That's going to be the longest part of your day. Each one of our operating rooms has a big screen TV on the wall. So essentially for that part of the surgery, you'll be watching Netflix, or you can do emails on your phone or listen to a podcast through your earbuds or something like that. We take breaks for you to go to the bathroom, to have lunch, or maybe just to stretch your legs. And then that's it. Once the grafts are in, that's essentially the end of your surgery. We'll take some time to review all your post-care recovery things, and you and I will, kind of briefly talk about that next. And then you go home. You can drive yourself to your appointment. You can drive yourself home.
Oh, okay, that's great. So what does the first week after surgery look like?
It's really kind of like the first 10 days when you'll be in recovery, so to speak. So there's no bed rest or anything like that. You'll, for all intents and purposes, be able to go about the normal parts of your day. There's a few things you might not be able to do, like very heavy exercise that causes a lot of sweating, contact sports, wearing a tight helmet, those kinds of things. But, you can certainly work from home, go out and get groceries, that kind of thing.
Is there any medication that I still have to be on?
Especially in a case like yours, there's no extra medication that you need to take. There's no antibiotics, there's no special creams or solutions or anything like that. Typically, I do recommend that people who are not already on minoxidil might want to start minoxidil for at least a year, but you're already on that medication, so you'll be resuming that about 10 days after your surgery when it's safe to put that in your hair. The first 5 days are the most critical as the grafts are getting established in place. 10 days is also a pretty critical period. And we'll go through with you a series of steps to keep those grafts healthy and viable. And that basically means keeping them moist a couple of times a day. There's a variety of ways you can do that via spraying or soaking in the bathtub. And we'll go through with you what resources you have at home and find the best way for you to do that. We'll teach you exactly how to sleep on your pillow so that you avoid touching those grafts as they get established into place. And we always call you the next day just to see how your first night was, answer any questions, make modifications to that routine. After 10 days, you'll basically return to what things were like before you had surgery, meaning you won't have to do anything special. Those grafts are in place. You don't need to take any special care of them. We'll teach you how to wear a hat to conceal those grafts if you want to leave the house, for example. In fact, we provide you with a free hat and teach you how to wear that on site so that you know how to do that. But honestly, for the most part, you can go about your normal day-to-day activities, especially with people working from home so much these days. There's even less interruption in your schedule in that regard.
Well, that sounds great. I hadn't really thought about the 10 days after the surgery, everything that's involved in making sure that it's a successful transplant.
It's about a twice-a-day affair for about 10 minutes. So you're looking at about 20 minutes of care per day total to help keep those grafts healthy and viable. And then, of course, in a case like yours with an FUE surgery, we'll be shaving your head. So the hair that we shave is going to start to grow in immediately. You'll have 2,000 little tiny holes at the back of your head where we did the excisions, and those will shrink by about half every 24 hours. So by about 5 to 7 days, those are virtually gone, not to mention that they're concealed by the growing hair at the back of your head. You'll have little incisions on the top of your head as well as some scabbing and some crusting. It may take up to 10 days for those to go away. And if they're not gone by 10 days, we give you instructions on how you can wash those out of your hair. In some cases, those are gone a little before 10 days. Sometimes there's a little bit of residual pinkness and redness. And for most people, that's gone by 10 days as well. With all our surgeries, we include a PRP soaking of the grafts, meaning we take your own platelet-rich plasma, we soak your grafts in it before we insert them into your scalp so that it gets into your scalp in that way. And there's evidence to show that speeds up the healing time. So it reduces the scabbing, reduces the crusting, and reduces the redness associated with surgery. And people often ask me about the pain as well. And with this surgery, with the FUE surgery, there's very little pain. We will provide you with a prescription for a bit of a stronger pain medication, but the majority of our patients don't even need it. They take regular Tylenol for about 24 hours after their surgery, and after that, they don't need anything. For a strip surgery, there is a little bit more discomfort for the first 24 to 48 hours, and we will provide those patients with a prescription. But in your case, you probably won't need to take that medication. You'll have it on hand if you need it, though.
I guess one final question I have is, who does the surgery?
Good question. At our clinic, I do the surgery. So I know there are some places where, like a non-medical technician might do the surgery, or a robot might be doing the surgery. Obviously, we feel there's a few disadvantages to that. So in terms of the robot, for example, often the punch that's used is actually a little bit larger. So the resulting sort of incisions can be a little bit more obvious. There's also no way to inspect the grafts when the robot extracts them. Obviously, with a non-medical, technician, there's a bit of an issue in terms of, making thousands of incisions on the back of your head. At our clinic, I do the surgery myself. So I extract every single unit. Every single follicular unit is then inspected by one of my staff. And I make all the incision sites in the recipient area as well, meaning it's me that makes the decisions about where each follicle is going to go, the direction, the angle, etc. And that's getting harder and harder to find at North American clinics where the surgeon is the one actually doing the surgery.
So how many people are usually in the room during the surgery?
So myself is there. I have a surgical assistant who helps me extract the grafts as well. And then I typically have 2 people who are follicular unit graft inspectors. So each of them are looking under a stereo microscope. One of them will inspect the graft, make sure it's a healthy graft, send it on to the next one so that it gets another inspection by another person to make sure it's a healthy graft. And then once the 2 of them deem it to be a healthy graft, it goes into a collection pile where it's chilled for preservation until it's ready to be inserted back into your recipient area. So typically we might have 4 people in the room during your surgery, not including yourself, of course.
Okay, well, this has been really insightful. So what do next steps look like?
So what I'll do next is I'll email you directly like a brief summary of our conversation, and I'll provide the phone number for my scheduling coordinator as well. So you can call her up and start going through the schedule in order to book your surgery. Once I do that, you'll have my email address, of course. And if you have any follow-up questions, you can simply hit reply and ask more questions rather than having to schedule another meeting. That way it's easier. If something comes up, you and I can just chat a little further by email.
Well, thanks, Dr. Huber. This sounds great. I'm really excited about this.
Yeah, me too. You can expect an email from me shortly. And otherwise, if you have no other questions, I'll look forward to seeing you on the day of your surgery.
Great. Okay. Thanks, Dr. Huber.
It was nice to meet you. Take care. Bye-bye.
Okay, bye.
So that was my virtual consult, but just so you know, Dr. Huber did make himself available after the consult all the way up to the surgery for any questions that I might have. If you like this video, make sure to watch out for other videos in my series. Thanks for watching.